Okay guys, so I want to show you some overhead mobility exercises for pre-workout, post-workout. It doesn't really matter if you have shoulder issues and shoulder pain. This is something that's a good distraction technique to really open up the joint. Obviously, if you have anything structural going on, please talk to a doctor or your physician to make sure that there's no damage that you can do with this exercise. But if you don't have anything diagnosed, if you have some clicking or popping in the shoulder, if you sit at a desk, anything like that where you have some sort of internal rotation or protraction of that shoulder, right? Anywhere where our humerus, and we have a humeral head and it sits inside the AC joint. So we have this ball and socket joint. Now anytime we get anything going into internal rotation or protraction, anytime that shoulder joint starts to move around, that ball and socket joint now starts to move this way. Okay? And then as you start to move your arm around, right, we get this articulation, but it's in the wrong position. So what we get is a lot of clicking, cracking, tendons and ligaments running over themselves. We have things called bursa sacs, which are like padding in the joint. And if we're always on one side, we can get an inflamed bursa, then you can get bursitis. So all we really need to do is focus on something called joint centration. We need to get that humeral head centrated in that joint again. Get it centered so that we're not going to be in any pain when we start articulating. Now, if we focus on joint centration and get that joint back in the middle, which is basically good posture from an internal rotation position, then all of a sudden we have a lot less neck tension. Our delt starts to fire properly, our rotator cuff fires properly, we're not at risk for rotator cuff injuries, all of those things. So it's really simple, 4 different movements, probably takes about 5 minutes per arm. To start, I want to show you, so we're halfway through here for myself right now, so I've done my right arm already, so we can see some of the traction differences already in a forward point of view, and then from a lateral point of view, we can see that I have some better range of motion than with my left arm. So as I said, I've done my right already, so this way it looks a whole lot better. It actually feels a whole lot better as well. And now we're going to do my left, and we're going to match it up after. So to start, have a strength band. Right now it's just attached to the top of a rack. You can attach it to a barbell that's on the top. You use a Smith machine. You really just need an anchor point that's above you. If you had a spot in your garage, you put a hook into a ceiling, into like a wood joist. You really just need something to provide some tension. So these bands you can get off of Amazon, you can get them off Fitness Depot. They're pretty relevant these days. They generally cost about 20 bucks. So if this would definitely be something I would advise to be part of your mobility toolkit along with the lacrosse ball. This is a great way to, when we're talking about preventative health, saving your joints long term, and not spending tons of money on therapists when there's something you can prevent yourself. So to start, we have the band hooked up here. We're going to use the back of the hand. We're going to get that band stuck in there pretty well. Then from here, we're going to take our 2 fingers with the bands together and hook in. So again, one more time, we have the band, right? It just goes on the back of the wrist there, band together, hooked in my fingers. So now I'm hooked, okay? I'm not going anywhere. I don't have to hold on to the band. It's pretty much stuck there. Now from here, we're going to start by walking our hips back as if you're doing like a Romanian deadlift. We don't want this rounding. Ideally, you're trying to really stick the pelvis out there. I'm struggling because my hamstrings are really tight from a leg workout yesterday. But we're really trying to drive our chest down towards the ground. We're trying to get our head what we call through the window. Get that arm back. A lot of us spend time like this all day. And we're trying to really open that up and get this shoulder capsule open. And one thing that people don't think about or they forget is that your latissimus dorsi, your lat, attaches immediately on the humerus. So what that means is that when your lat is tight, your arm will rotate inwards. That will cause internal rotation, just as your chest, or more specifically your chest, your pec major minor can cause internal rotation as well. And then our bicep can cause this protraction, this forward rotation of the shoulder. So people think, oh, I need to work on my posture, I'm going to work on my lats. That is incorrect. When you're working on posture, you want to work on scap protractors, the 2 guys in between the shoulder blades that bring the shoulders back, right? That is scap protraction. This is scapular depression. That's the lat. Downwards. Retraction is in towards the middle. So people end up doing a lot of lat work, and then it causes even more internal rotation and they're not actually helping themselves. So back of the hand, hooked in, down towards the ground. In this first position, again, if we're focusing on stretching and mobility, we want to focus on breathing. We want to breathe through everything. All our tissues, muscle, ligaments, fascia, everything works in cohesion with our breathing. So if we're not breathing, nothing's going to be able to relax or release. So from here, as you can see, I'm doing a slight rocking pattern. So I'm just pushing my shoulder or my torso towards the side I'm stretching, right? Okay, so I'm getting a lot of tissue that's opening up here. Okay, just pushing myself this way. Step 2 I like to do is push my pelvis down and away. Your lat goes from your humerus all the way down to your pelvis. So it runs right along here. So if I push my pelvis away like this, now all of a sudden I'm elongating that muscle even more. And I'm breathing, of course. Another one I like to do is looking up and through. So I'm taking my torso, my sternum, and I'm trying to rotate it. Right? Trying to rotate it. Reaching with my hand, trying to rotate my torso. Get a nice thoracic rotation. A lot of us are very rigid into our thoracic spine. Opening all of that up. Okay, so that's step number 1. Step number 2 is just a basic shoulder distraction. Distraction means that we're trying to open up the joint. We're trying to pull the humerus out of the shoulder socket. And not out as in dislocate, but just out as in create space. When muscles are really, really tight, they suction everything in together. And that makes for very tight spaces for that joint to articulate, causing things like bursitis, like I said, ligament issues. So we want to create some space in there. So all I'm doing is really using my body weight, leaning, trying to let things open up in there, create some space. 20 to 30 seconds is good here. Next, okay, we focus on the lat. Now we want to focus on things in the front that can also cause that internal rotation or kyphotic position, which is going to be our pec major and minor. Now, so more specifically, we're working on pec major, just based on the banded position and our elbow position. So what we want to do is we want to get the leg back of the same arm we're stretching. So whatever arm you're stretching, that's the leg that's going to be backwards. Okay, so from here we're going to go into a lunge. Now, if I'm over here, I'm not really accomplishing very much because there isn't much tension on the band. So I have to move myself forward. Now as I move myself forward, I see a lot of people that do this. Okay, I'm not really accomplishing very much here. I'm just kind of leaning forward. I feel a little bit of a stretch in through here. My arm isn't in a very good position. I'm not really directing my stretching. So what I want to do is isolate my chest. I want to isolate my pec and get this to open up. So what I want to do is I want to tuck the pelvis, squeeze the core, make sure my torso is nice and straight and I'm not rotating. And then from here, instead of having my arm like this, where I'm stretching my anterior delt, my bicep, and all sorts of things, I want to direct it towards my pecs. What I want to do is turn my pinky up towards the ceiling. And when I do that, as you can see, my elbow, my humerus rotates, and all of a sudden I got a nice pec stretch going on. So I keep the core tight, keep the torso tight, and if I want to add a little bit more tension, I just push the pelvis and my torso forward. And all of a sudden, you get a huge stretch right in through here. Working on my breathing. As you can tell, it's tight because I'm shaking. And then we're going to go into our last one. So we did lat, shoulder distraction, pec. Now we're going to hit our lat again, but we're going to hit it from a different angle this time. So this time we're going to go overhead again. Same arm, same leg is back. Okay. Again, for positioning, if I'm right here, I'm not getting much of a stretch. So I want to make sure that I'm in a good position to get a good stretch. Now, you want to make sure that you're in line with the band. You don't want to be back here where I'm being pulled forward, and I don't want to be here where I'm being pulled backwards. I want to make sure I'm in a nice straight line with the band so I can get a good stretch through the lat. Now from here, again, the lag goes from the humerus all the way down to the pelvis. So I'm going to work on pushing my torso away, and as I push it away, it's going to start to open up right in the scapular region. I'm working on my breathing again. I can do a little bit of rotation. As I rotate, I'm going to find certain spots that are very tight. And then afterwards, we check in to make sure that we did a good job. And I feel like that looks a little bit more even than it was before. And then over here, still a little bit tighter, but feels pretty good. Hope that helps, guys. Have a good one.